So I'm a Western grad. I was Med 2002, and I wasn't from London, and then I made a conscious choice to stay. A couple of reasons. Number one, I really liked the people that I was working with. So I'm talking about the teachers here. It was one of the few places where the teachers actually would sacrifice their own time to help you as a student. And even though when they don't really know who the heck you are. It's like one day I walked into the department office asking for a meeting with one of the faculty members, and I said, I just have this idea about, family medicine. And from then on, this person met with me, weeks after weeks, and that was just the way it is. So it was a place where, I really felt people cared about family medicine and cared about what they do. And most of all, it's a place where teachers cared about their learners, residents and students alike. And I hope most of you would have experienced some of that as you rotated through some of our sites. Because of that sort of mentorship experience, the sort of family that I really felt I belonged to, I stuck around, and I've been here since 1998, so, and enjoying it. So this is a map of all the places where you can do training in our catchment area. All the pegs obviously represent different types of training sites. And so just to illustrate the different types of programs we have. So the urban experience, urban, suburban experience, Windsor down at the bottom, and then London. Okay, so these are the two main sites for that type of experience. And then these four sites are our sort of regional programs. So we actually, here, we've got Mount Bridget, Stratford close together. We have Ilderton. Actually now the star up on the top is Tavistock, which this year we've actually moved that together with Stratford. And I'll come back to that. So the purple star is actually Stratford on the top and Chatham-Kent down in the south. So these are our other regional sites that are based in a somewhat bigger community hospital. And then we've got a rural program. So Hanover right at the top, Goderich by the lake, and Petrolia, Blue Waters, and Sarnia. And then the rest of these dots actually are all the various community hospitals in which you can do some type of clinical experience. So as you can see, there's lots of choices. And when you look at the CARMS programs, there's urban, right? And then London urban, Windsor, there's rural regional, and then there's all the rural programs, and then there's Stratford, Chatham-Kent, Petrolia, and there's all these different sites. The reality is that most of the time, where you match to doesn't restrict you from doing rotations in other places. Okay? There are some variations which we'll come to in some details. Obviously, a program that's based in Chatham-Kent, because of the fact that it has a relatively large hospital, most of the rotations are done locally. And if you match to Windsor, most of the time it makes sense for you to stick around in Windsor, right, instead of driving 2 hours away. So there's some of those considerations, but you're not restricted to stay in a particular area just because your family medicine is there. So this is a bit of a summary of the core clinical experiences and some of the stuff that you need to know about that's in addition to the clinical work that you might do. If you look across the country, the core rotations are fairly similar, okay, among all the programs. What they differ is in terms of duration. So most of our core rotations, with the exception of family medicine, are 4 weeks in length. And if you look at our core academic experience, one of the highlights for our program is our academic program, actually. So we've switched completely from the model where I need you to show up, and I'm going to take attendance, and if you don't show up, I'm going to punish you. And making you write essays, and then so forth. So we've gone completely away from that. We recognize that you guys are adult learners. You know how you learn best. You know what you need to learn. So we've changed it into a credit-based system, much like continuing medical education in real life when you graduate, where you have a certain number of credits you have to achieve a certain amount in a certain amount of time. And in the residency program is 300 credits, which is 300 hours of some learning activity. But you get to choose what you want to do. You can come to our half days, which are lectures based. You can go to a conference. You can go to some faculty development that's offered by Western for free. And also, you can also do your own reading if you like. We have other specific curriculums like behavioral medicine, which really teaches you some of the aspects about psychology, communication, and psychotherapy. We have a curriculum around ethics. And then every resident actually is mandated by our college to do a resident project. So this is the same across the country. And we have actually many options for you to do this. It does not have to be a research project, but it can be. And then there's other things like a medical education project, patient education, community outreach. So many things that really is an opportunity for you to do something a little bit interesting for yourself and also something that's good for patient care. This is a slide that gives you some basic ideas of the comparisons between the various training programs. If you look at the PGY1 experience, it's mostly block-based. It's actually completely block-based. And what I mean by that is that you have chunks of clinical experiences. So you have your family medicine block, and then you have 4 weeks, much like clerkship in psychiatry, 4 weeks maybe, not psychiatry, 4 weeks in medicine, emerge, and so forth. Okay? Second year is where it differs somewhat depending on which program you apply to. In the urban type of programs, so Windsor, London, they're pretty much block-based. But in the regional program, there's a few sites. So Stratford, Town, Kent, they have what we call longitudinal setup where there's a lot more family medicine in terms of length in the second year, but you get to have some enrichment experience with specialty experiences mixed in with that. Okay? And then in the rural program, Goderich is what we call our complete longitudinal program in the second year, where you're based in family medicine for the entire 12 months. And Dr. Parr will come to some of the details about what actually happens in that year with you guys. In terms of the family medicine experience, okay, locally, so sort of in London and in Windsor in an urban setting, you'll be doing hospital work, office-based care, but no emerge, okay, and maybe some nursing homes. In regional and rural, everything is integrated. Okay? And this is where you do the whole shebang. Emerge, inpatient care, obstetrics, and office-based care, all within your family medicine block time. And really, if you look at regional and rural, the difference really is regional is really pretty much sites in which you can drive to easily, and you are able to live in London and still drive out for those training programs. This, electives, is really the highlight of our program. We want to be flexible, and we want to allow flexibility for you to learn things that you want to learn. So we have lots of elective time compared to most other programs. It does vary somewhat depending on the specific program that you match to. So in the urban program, it's roughly 8 weeks. In a regional program, it's 4 weeks. The shortest one is 4 weeks, but it has a lot more longitudinal elective time. Okay, so it actually works out to roughly the same. Up to 10 weeks, and 10 blocks actually. That's 8 blocks and 10 blocks. So each block is 4 weeks. So there's lots of time for that. And then in the rural program, it's between 5 to 6. Yeah.
So if you're doing, say regional, you have obstetrics in your family medicine rotation.
Yes.
Do you also do a block of obstetrics?
You do, yes. Because there's actually, most of the time, quite valuable experience to have a really concentrated experience where you kind of get really used to how, the mechanics and the hands-on stuff. So this is what really drive our programs, these 4 pillars. So one is leadership. So there's a bit of a story about this because I realized that when I took over as program director, I had no leadership training, no management training, and you kind of fly by the seat of your pants. And more increasingly, every physician who graduates are being called to take on some kind of leadership role. I'm sure many of you would have experienced this in your life already. Some family member would have called you at some point in time asking for an opinion. And sometimes it's not even medical stuff. And this is just the way it is. As a physician, you're a very respected member of society, and people look to you as a national leader, whether you are in fact one or not, and whether or not you've had ever any training in that area. So we recognize that, and we built a leadership program so that we can ensure that some of the residents who are really interested in this area can gain the type of skills. So this is pretty unique to Western. We've pretty much started this fad. Now it's kind of moving across the country. Some other programs are starting to talk about this. U of T is getting one started. So really, this is one of the key things that we want to be able to help our residents develop is leadership skills. Well, I talked a bit about flexibility, and again, it's the choice that you have within our program, the amount of elective time, as well as also the academic program that you can have a choice about how you want to learn. Okay? And again, the fact that even if you match to London, you can actually do rotations outside of London. And actually, some of our residents are matched to London, and they do rotations in Windsor because some of the rotations are great. Support. This is a huge aspect of our program. If you talk to some of the residents, you'll learn about the Family Medicine Residency of Western, which is an organization run by our chief residents. So Cecil's here with us tonight, and he can tell you more about that. And really, this organization really looks after the residents, your social needs, and the sort of extracurricular stuff that you need to sort of get by. So some highlights, every year we have an orientation barbecue. We have lots of fun. There's some photos the earlier photos that Jess showed was one of those. There's each site that we have a competition basically in games and whatnot. And then usually there's a golf tournament, and then in the fall, and then a semi-formal in the winter or early spring, and then of course graduation and parties thereafter. And in between, there's some other occasional activities. We've done some wine tasting in Pelee Island, so a lot of residents went down south. So lots of social stuff. You won't be bored if you're not on call. The second thing is we have a very, very good resident-faculty ratio. So some sites we're up to 5 teachers to 1 resident, and at most there'll be 2 residents per 1 preceptor. Okay, so very, very good ratio. So you get a lot of personal attention, get a lot of mentoring, and of course we have a faculty advisor program here in which you would be matched up to a preceptor, usually your own preceptor, over the course of 2 years. And then you have meetings throughout the 2 years, so then you can do some career planning, get some advice and review of how things are going in the residency program. And lastly, dedication. This is about allowing you guys to be involved in the decision-making process of our program. In all our committees, we've got resident representatives, and in some committees we have more residents than actually faculty. So residents have a very strong voice in what actually happens in our program in terms of policies and structural changes. And this is because we want to dedicate the program to your educational experience. So these are some of the pictures. I like these because the people who are in the pictures are actually here. So this is me, and I believe that was Shiraz. Where are you, Shiraz? Are you in here? Was that you, right?
It's me.
Oh, but this is you. So Shiraz was one of our ex-chief residents, and he's a really laid-back guy. Okay, as you can tell. That's actually Jess taking a really good shot. Didn't you win the women's longest shot? Or
I did.
You did, yes. And of course, so this is from the orientation barbecue where actually our center won the trophy at St. Joe's. This is sort of not real money, Monte Carlo night at I forgot to tell you guys about this. So we focus a lot on practice management business skills. There's about 10 hours worth of teaching throughout the 2 years, and a retreat that happens in Grand Bend every year. So where accountants, lawyers, and bankers come in to talk to you guys about the business aspects. More pictures. So this is our semi-formal. There's a lead dancer. I won't tell you who that is. And then some of our faculty members got involved as well. And the lead dancer is actually here tonight, if you can guess who that is. So I want to end with this picture. Really, this was a hike that I did that I almost got. Actually, I did get lost and almost didn't make it back, and I had to call the police. But I made it down. But I mean, really, I think residency is a rite of passage, but it's also a time of huge transitions and transformations. And really, at Western, we are your partner, okay, in really achieving your goals and dreams in life, and as a person and also as a professional. So I'll let the rest of my counterparts tell you more about the program and some of the details you would want to hear about. But thanks very much for coming, and I look forward to seeing you guys again on the interview day. And I'll be around for questions, of course.